And good morning. The pre-recorded show today, it is For Your Health, a presentation of Medica Pharmacy. And in studio with us this morning, Alyson Schwartz. And good morning, Alyson.
Good morning, Roth.
Well, it's a beautiful day here as we wrap up the month of September, and we wrap up, I guess, anniversary month at Medica Pharmacy.
Yes, we did. It's 32 years this month. So, yeah, it was a good month.
And things get heading into fall. People start to need to make adjustments in their activities, but I know that you've been out running this morning, and so maybe some people say, okay, it's too hot to exercise in the summer. It really isn't, because you can always find a time of day. But now as we head into fall, we again encourage people to get some type of physical activity, and no matter whether it's part of work or part of exercise or part of something, but do something to get the heart and the lungs and the muscles doing something more than getting up and getting down.
That's exactly right. I mean, this time of the year, it's beautiful time to get out and go out for a walk, a jog, a run, biking, whatever it is you want to do. And inevitably it's either too hot to work out or it's too cold to work out. But when you do exercise, your muscles use a huge amount more energy than they normally do. So it's going to burn up the extra blood sugars and the extra fat. And interestingly enough, you actually have an easier time doing that if it is cold. So when you work out when it's cold, your body is expending energy and burning calories trying to stay warm, and then it starts to burn the calories as you exercise. So the best way to burn off fuel and burn off those fat cells is to do it when it's cold outside.
When it is cold, that's true. Even though most people think, well, I've got to be expending more energy when I'm perspiring like this, but really that's the easy part. My body does that all the time, very easily.
Exactly. Well, exactly. Like I said, it was 46 degrees this morning, and I came in here with a bright red face, looking like I'd been out, and it was 120 degree weather. So, so you actually, your blood cells really get flowing when it's cold. So you'll burn more calories that way. So get out and walk and jog and bike and enjoy this beautiful crisp morning that we have.
Well, that's not our topic today, but we always encourage people, and I know you do anyway, to get exercise and do healthy things, whether it be diet and exercise. And we put them both together, it's the double good. But today our topic is lactose intolerance?
Lactose, irritable bowel syndrome. We're going to just talk about digestion in general. I know we talked about acidity of your stomach and whether you actually had too much or more commonly you have not enough. We talked about that a few weeks back. Right. So we want to talk about other digestion, because I don't think people understand how much digestion affects just about every illness that we have, from simple skin conditions like acne, psoriasis, and eczema to full-blown allergies and asthma and autoimmune disorders. So we thought we'd start kind of going into a little bit of digestion to see if we can start fixing people's digestive problems. We're going to make them healthier long-term. 70% or more of your immune system is in your digestive tract. So it's very important to think about those little bothersome things that you just kind of take off to, I ate too much fatty food, or, I went to McDonald's or whatever it was. You need to really consider what that effect that's having on your digestive tract and what it's going to do to your body long term.
Now, does our digestive system and all the things that work within it change for better or for worse as we get older?
It does. It really does.
Not just our idea, not just changing it. Actually, we have to kind of behave differently.
We do, and there are lots of things you can do to supplement it, but the perfect example of things that change when you age is actually lactose intolerant. As we age, a lot of people no longer make that enzyme lactase to break down the lactose sugars in milk. And what I tell people, it's so funny. You get people that say, I need more calcium, but I don't like milk, or I don't want to drink more milk. And I always tell them, we are the only mammals that continue to drink milk once we're weaned from our mothers. And we're the only animals that drink milk from another animal. And we are not designed to drink and digest cow's milk, truly. And you do not need to drink milk to make sure you have strong bones. There is so much more to bone health than calcium, and you have to have magnesium and boron and silica and phosphorus and all these other things. So just taking calcium, actually, and I'm a big promoter, if you just take a calcium product, you're going to make yourself magnesium and zinc deficient. Then you're going to have muscle cramps. You're going to get constipated. You're going to have gas and bloating. So there's a lot more to it. So if we're not going to digest milk past the age of anywhere from 3 to 5 typically, then there's not really a necessity to need it. Now, if you love milk and you tolerate milk, by all means, drink it.
It's good. It's good. It's got a lot of good things in it, doesn't it?
It does. It also has a lot of bad things in it. The way we pasteurize milk, and we can't. I know in this state it's not legal to sell unpasteurized milk, and a lot of states it's not. Well, when you pasteurize a product, you actually take away a lot of the good bacteria that live in that product to protect it. And so, when you pasteurize milk, you do take away a lot of the benefits of it.
Yeah.
Like I know people that have been to London, they'll say, you go in the stores and the milk's on the shelf. It is not in the fridge. So if you don't pasteurize it, then it actually can sit at room temperature for a little bit without being hurt. And then, of course, the other thing is there are tons and tons of hormones and growth hormones and steroids in milk that we give to our cows. And this is a totally different topic for a different day, but you're starting to see that men's fertility is being affected, and sperm banks are getting to where they cannot get enough good quality sperm from sperm donors because even young men don't have good quality sperm, and they really think it has to do with the estrogens that are in the milks and the estrogen that's in the water supply due to so many women on birth control pills. So scary. So topic for a different day. So lactose intolerance. Let's go back to that. Okay. So it happens in the small intestine most of the time. So there's two different kinds of lactose intolerance. There's the one where you lack the enzyme to break down the milk sugars, and so that causes kind of the gas and the flatulence that you are associated with it. And then there's the other type of lactose intolerance that actually occurs because you don't have enough digestive enzymes to break down any of the milk proteins. That causes usually more severe reactions, and it typically all happens in the small intestines, and so that's where you start to have major issues. So you can either have you get gassy and bloated, maybe you have diarrhea, or then you can get the really bad reaction where you're not breaking things down and everything kind of attacks it, and then you have a full-blown kind of allergic response, or maybe you get really, really severely constipated. So two totally different things. We also see a lot of lactose intolerance in premature babies because their digestive tracts are not developed. And if you don't have that proper flora in your digestive tract, and I know we've talked about probiotics before and the need for so many Americans to be on them because so many Americans use lots of antibiotics, or you're getting antibiotics in the food products that you're eating. So you're killing off your good bacteria that keeps you healthy. If you don't have that good, healthy bacteria, then you can't properly absorb and digest the proteins in milk. And so that's a lot of times what we'll see in premature babies. And it just, I started doing this research, I had a student from the University of Kentucky that kind of helped put this stuff together. And we were looking at that, and I thought, well, I wonder if that's maybe sometimes why premature babies are so bad with reflux, because they don't have that digestive tract they need to digest the milk, whether it be breast milk or formula, properly. And so that's why one of the reasons we always recommend probiotics to our infants is it can't hurt them. It may not fix them, but it sure cannot hurt them to colonize their body with the proper bacteria. So you get lactose intolerance at different times in the life. It's in the white population. It typically occurs past age 5 is when you start to see it most commonly. In African Americans, it's more commonly to be seen around the age of 2 or more. So I know last February we talked about the differences between blacks, African Americans, and the white Caucasians with various diseases. Well, here's another example, is they tend to lose that ability to digest milk sooner than the Caucasian population. It is more common people with Asian, African, Native American, or Mediterranean than it is amongst the Northern American and Western Europeans. So I thought that was interesting. But typically you get symptoms anywhere from 30 minutes to 2 hours after you eat or drink milk products. So this can be milk, yogurt, ice cream, and large doses of, you drink lots and lots of milk, obviously you're going to have worse symptoms. Yeah. So you can get anything from just abdominal bloating, cramping, diarrhea, gas, sometimes nausea and vomiting. And occasionally infants and children it may slow their growth or cause weight loss just because you're not getting any nutrients because you're not breaking down those proteins.
Well, now, you may be going to this, but I'll go ahead and ask the question. What about if somebody likes dairy products? Is there something they can do to take that will allow them to be able to, within reason, enjoy some dairy products? Yeah,
there absolutely is. So, it depends on what the reaction is. And so we talked about it may be just that you don't have the proper flora to digest it once it hits your intestine. Yeah. So we always go with a good probiotic. We have, 2 that we typically recommend. We have a new one that's specifically for women. Again, kind of a little bit different topic for a different day. But you also have digestive enzymes. And we pretty much have 2 different digestive enzymes that we recommend. And it completely depends on the situation. So A lot of people that have just a kind of chronic diarrhea, or they tend to eat meals and things go right through them, there's a product called Panplex that you take with meals. If you have really bad allergies and you think maybe it's a milk allergy, or you don't tolerate milk, but you also have just really bad sinusitis or chronic respiratory infections or bad asthma, there's a product called Biozyme. And the difference in the two is that Panplex is more kind of what your gallbladder or liver would do, so especially people without a gallbladder can benefit greatly from this. But people that don't create enough pancreatic enzymes to break things down, especially if you're diabetic and you have those really bad allergies, the Biozyme you actually take away from meals. And what it does is it works to digest the proteins in the intestines. Panplex is more, let's break it down in the stomach before it gets to the intestines. The Biozyme hits the intestines and helps to keep the intestines from having that really bad reaction to where it sends things flying out the back door, or causes that allergic reaction. A lot of times we see that if you don't have the good flora, that proteins of food will attach to your intestines and cause inflammation. So the Biozyme breaks those attachments away and kind of cleans out your intestines to get rid of those allergenic properties. So they work very differently, and it's not, you can't just walk in and pick up a digestive enzyme. I mean, you could, but the chances that you're getting the exact right one is probably not so good. So make sure you're talking to somebody about your exact symptoms before you think that digestive enzyme is what I need. But we've seen huge improvements. And I'll be honest, I'm not one to be shy to say that I don't have a gallbladder. I haven't. Started having issues a couple months ago. I put myself on the Panplex, and I was amazed actually at how much better I felt, because I always tell people, oh, they'll help. I never really thought my symptoms were enough to worry about until I decided to try it for myself, and I'm amazed at how much better I feel and how much better I digest the food that I eat. So it can help with the milk protein parts too.
Okay.
All right, so we're going to move on from the lactose intolerance to irritable bowel syndrome, and so you see that on the TV all the time, and you see the Activia people and the Yo Plus and the Dan Active yogurt people trying to promote their products for irritable bowel syndrome. And well, that's because irritable bowel syndrome is most commonly a deficiency of good bacteria. And so the problem is maybe you're lactose intolerant and you have irritable bowel. Well, then you don't want to eat yogurt to fix your irritable bowel. You want to go with just a probiotic. So this is typically, you have very similar reactions and very similar symptoms that you do with lactose intolerance. So the bloating, the belching, the pain, the cramps, the diarrhea, maybe the constipation. And with irritable bowel syndrome, we often see that some people have just kind of chronic diarrhea, but there are a lot of people that go from diarrhea to constipated and back and forth. And it's very frustrating because one minute you're running to the bathroom and the next minute you're in pain and you can't go to the bathroom. So again, that has to do with the right intestinal flora. It also sometimes it starts with kind of reflux that we talk about. And of course, we mentioned before, reflux is often a digestive problem, not necessarily an acid problem. So what happens is when you don't have that flora, you are not able to absorb food, but especially you're not able to absorb vitamins. But it also affects the movement of your intestines. So when you don't have that good bacteria in your intestines, then stuff either moves through you way too quickly or not fast enough. And so that thing keeps things going at a good pace so that you don't get constipated, don't have diarrhea, don't have reflux, don't have the gas and the pain. So it's real important with irritable bowel, if you think you have it, to at least start on a good probiotic. Be careful of your probiotics. Some of them are formulated in dairy. So if you already don't tolerate dairy very well, then if you get a probiotic that's formulated in dairy, it's going to make you worse, or it's not going to help you at all. So again, just it's a conversation to have with your pharmacist. We do a lot of that. So please, come by and talk to us about which probiotic might be right for you.
So am I hearing, though, that if our issues, we'll call them our issues, happen just when we have a dairy product, it's lactose?
Probably.
But if it happens with a variety of things more than just dairy products, it may be, I like to call it, IBS.
Right, it might be IBS, exactly. And so a lot of times we'll tell you, if you have symptoms and you think maybe it might be wheat, because we have a lot of people that have this reaction with gluten products, and then milk products are casein proteins. And so, is it a milk product with caseins? Is it a wheat and a gluten product? Or is it just a generalized, you have terrible digestion? The easiest way to kind of figure out what it is let's take away a food product.
Yeah.
So do the food elimination thing, because really within a couple of weeks you should feel way, way better. And if you reintroduce that food, you're going to feel awful again. So that's the easiest way to figure out which one it is.
It's not like an overnight type of thing, but you'll figure it out.
You're right, exactly. And at any point, adding a probiotic or trying one of the digestive enzymes may help you. But you have to keep in mind that we talked about in the beginning, proper diet. Mm-hmm. Well, to keep your intestines bacteria happy, the good bacteria, you have to have proper fiber. And if you don't have good fiber and you tend to eat, it's almost impossible to eat a really good diet anymore. And we know for a fact that the average American eats mostly processed and fast foods. And that's high carbohydrate, high sugar. And when you do that, you're feeding the bacteria in your intestines, but you're feeding the bad bacteria. And so, we have lots of cases of the C. diff. That's not very uncommon for people to come in and go, oh my gosh, my child or me or my brother has C. diff, and you have really god-awful bad diarrhea that can kill you. You need to understand that C. diff can kill you. And when you're eating high sugar and high carbohydrates, you're feeding the C. diff in your intestines. You're not feeding your good bacteria. So the good fiber from your vegetable and fruit sources is what you want to feed the good bacteria to keep the infections from happening. Okay. All right. So I know we mentioned that we might talk about some psoriasis and eczema, and you may be wondering, well, how are we going from lactose intolerance and IBS to psoriasis and eczema?
These are things that are inside versus things that are outside.
That are outside, right? Yeah. Exactly. So the reason that those two tie together is because your skin and your intestines are made up of the exact same cells as you're being formed as an infant. And anytime you have something that's considered a toxin, and if it gets through your intestinal tract and into your bloodstream, really the only way it has out is through your skin. And so psoriasis and eczema tend to come out as there is some kind of imbalance in your digestive tract, and so your body is trying to clear those toxins out through your skin. Now, the thing about psoriasis is it can be awful. It's big, thick, plaquey skin condition, red, irritated, and usually it's really thick. It's kind of a silver, white, plaquey thing. They call them scales, and it usually occurs between 15 and 35. And it's not very nice to look at.
Age? You're talking about age.
Age, 15 to 35 years of age, sorry. It does seem to come in families, but typically if your mom has a digestive issue and you're all eating the same kinds of foods, then that makes sense to me. Yeah. Now, is it related? I can't for sure say, but it makes sense to me that you're eating the same diet as your parents. And so if your parents are eating something that's causing digestive issues, they may pass that on down to you. But usually your skin's kind of, your skin starts down in the deep layers and then it grows up. So if you have those toxins in your bloodstream, it attaches to those little layers and it comes out your skin. So there are things that can trigger a psoriasis attack. Bacterial or viral infections make sense because you don't have enough good bacteria to kill it off. So strep throat and upper respiratory infections are included in that. So it's not just the digestive thing. If you have dry skin already, typically if you have dry skin, you're either not hydrated enough or you have an omega deficiency. So you have to keep your skin healthy. So make sure you're drinking your water. Anytime you have any kind of injury to your skin, it might heal strange. Stress, and then you go anywhere from too little sunlight to too much sunlight. So, that, like we've talked about before, the proper amount of sunlight is good for your skin. Not enough, you don't get the right minerals, and too much, obviously, can cause cancers. So you usually get the irritated red flaky skins. Usually it's on the elbows, knees, middle of the body. Red patches can include anywhere, including up in your head and on your scalp. It's dry, it can be pink, it might be red, and it's raised and thick. Now, you can treat it topically with cortisones and different creams, and then there is the high specialty drugs that can really take care of it but have just a plethora of side effects. And I know that the different drugs like Enbrels and things for younger kids we're starting to see these in younger kids. They've been linked to all kinds of cancers. So if you can go with a digestive look at it and see if we correct any digestive issues you're having, if we can better your psoriasis that way, don't we think we'd all be better off than having to spend thousands of dollars on specialty drugs? I think it's worth a shot. It may not be the answer for you, but I definitely think it can't hurt you. It might take care of your psoriasis enough to where you don't have to go high dollar injections or any, all these creams that long-term effects are questionable. So it's worth a look at it.
Now, would you see a dermatologist on that? Because you've described that it very likely could be something that an internist would want to make the diagnosis on. But most people, when they have those psoriasis and things that you just talked about, would say, whoop, got to go to a dermatologist because this is a skin issue. But you're saying that we have a skin issue because we have a digestive issue. Yeah.
Exactly. And you can, obviously, dermatologists are quite well trained at what they do. I guess my concern with, as we're starting to see, is we have dermatologists and cardiologists and podiatrists and nephrologists and all these people that are specialized in one area of the body. But our body is one body, and it is all related. And so I just can't seem to think that whatever you have going on doesn't affect something else somewhere. And so until we start tying it all together, then I would say not only see your dermatologist, but see your internist as well, but make sure they're communicating and on the same page. Because, and we see it in the pharmacy oftentimes, that you'll come in and you'll have, one doctor that wants you on this drug, but then another doctor that says, no, don't take that drug, take this drug. And patients are confused, and we're confused because we're not sure which drug do they want you on. So so we start making the phone calls, but make sure that, when you go to a doctor, take a notepad with you and write down notes, because we know patients forget 60% of what they hear in the office by the time they get to the car. Okay, to the car, not even home. So when you go to any doctor, please take something, write down notes, ask questions. And so then if you're referred to a specialist, take down more notes and then compare the two. And if something doesn't quite make sense to you, then make sure we're finding out the answer. I mean, it's real important that we're not just treating the skin or just treating the heart. We got to treat the whole body.
Yeah, exactly.
So.
All
right, last one, eczema, and we'll be done for the day. So psoriasis is real thick and plaquey. Eczema is more patchy and not as bad. So it's usually a hypersensitivity reaction, and you get kind of localized redness and itching, and usually you see it in infants from like 2 to 6 months and then on up. It, again, can be allergies. It can be due to cold and dry air, contact with rough materials, or irritated skin. The one thing about eczema that's it's not like as kind of serious immune system as psoriasis. Psoriasis is considered a much more serious thing. But I will tell you, again, major digestive issues. And we have had huge successes putting children on a probiotic to treat their, not only their digestive tract, but their skin, but putting them on a good quality Eskimo 3 fish oil, because fish oil is nature's best anti-inflammatory, and eczema is an inflammation response. And so we have had some really, really good luck getting kids' eczema to really come down by trying those two things. If you want to go with the steroid creams and that, absolutely get your symptoms under control. But long term, give the probiotics and the fish oils a shot, and you'd be amazed at how much better your eczema and potentially your psoriasis will be.
Don't treat the symptom, treat the cause.
Exactly. Treat the cause. Yeah.
Interesting note, I believe in one of our last shows you talked about, we not only talked about flu shots, but you talked about a shot for the shingles.
Yes.
And a friend of mine just yesterday said, I've got a shot. I've had my shingles shot. It's hard to say. And I said, isn't it amazing that I did not know, and neither did this person, that was an option until you did your show, and this person's doctor highly recommended that they get that.
Well, right after we did that show, we actually had a gentleman that came in with shingles, and he was miserable with itching, burning pain. Yeah. And I explained to him, when your symptoms kind of resolve, talk to your doctor about when is a good time for you to get vaccinated, so that hopefully you don't have reoccurrences.
I was getting ready to ask, that can reoccur because it is a virus.
It
doesn't ever go away.
It ever goes away, so it harbors in your system. And shingles typically recurs when you're under a lot of stress or if you get sick, and so it's there forever. So if you can get that vaccine, and so that if you do get a reoccurrence, you have minimal symptoms. I mean, that's definitely a way to go. But since we're talking about vaccinations and it's cold, it is flu shot time. So please come get your flu shot. We're starting to get a big rush of them. You want to make sure you get it fast. It's $20 if you don't have insurance. We can bill most every insurance. We'll at least give it a shot. So, walk in, call, set up an appointment. We do both. So get your flu shot. And then we have a health fair coming up, Flage's Health Fair at the end of the month.
Exactly. On Saturday, the 29th, from 11 till...
I think 2.
2? Out at the hospital?
I texted Garrett to ask him, and he's probably fussing at me because I think he answered me and I didn't have a chance to check my phone.
But, anyway, the listeners here of this show will be able to hear that program next week twice that we're getting ready to tape this afternoon to remind and tell people about the health fair presented by the Foundation at Flagey Memorial Hospital and Medica Pharmacy, and look forward to that because, man, there's going to be a lot of opportunities for people to learn about healthcare and also to get a lot of services or some testing free and plenty of information.
Oh, exactly. I know we have a couple of tables, and I'm giving a little bit of a talk, but then I also have Kathy Leet from Integrative Therapeutics. She is a certified clinical nutritionist. She's been doing it for 30 years, so she's kind of the go-to girl when you have a nutrient depletion supplement question. I mean, she is just a wealth of knowledge, and so she's going to be there to talk to people and answer questions. So if you have a question about some kind of supplement or you're not sleeping or whatever it is and you can't find me, then Kathy will be at our booth. So stop by and talk to her because she's just a wonderful, wonderful lady, and she's has amazing things that she knows and does.
Wonderful. And that is Saturday, September 29th from 11 until
2. We're pretty sure 2.
Yeah, it is. It's
okay.
I think you're right.
Don't quote me.
And that's going to be out at the Flagey Hospital. So, well, Alyson, thank you very much for coming in today. And this program, we hope, gives people some information that will help them feel better. But as always, you highly recommend diet and exercise.
Always start with diet and exercise. Yeah, fix the inside of the body before you can fix the outside of the body. And if you have questions, of course, we always record these shows and we put them. We do have a YouTube channel. You can find them. So go to medicapharmacy.net, find us on Facebook, and find the links to these shows. And all obviously call, stop by, or send us Facebook or website messages, and we'll answer those questions as soon as we can.
Thank you very much, Alyson Schwartz from Medica Pharmacy, our host this morning on For Your Health from Medical Pharmacy. Thank you, and we'll see you, our listeners, and Alyson in a few weeks.